Aphasia is one topic we keep getting ignored for, and they think that speech can be addressed much later. The patient or the geriatric population generally gets stroke or hemorrhage in the brain, and they could lose their speech immediately. And sometimes even their understanding will be under loss. They'll not be able to speak and swallow. Their memory can also be lost. So the doctors or the family members might address their priority problems first and ignore the speech problem. So the moment the stroke is attacked or the hemorrhage is identified, we need to see where in the brain the major areas are affected. So once the brain is affected, it cannot be completely recovered or regained. Only the surrounding areas has to compensate for the actual skills which we are needed. So a speech therapist earlier seen by this patient can identify which area of the speech is affected and how much is it affected. So in case it's a severe problem, the patient is unable to speak at all, then we need to treat it as a different way as such, and with a lot of specific techniques, strategies and methods have to be used. In case the patient has slight speech, but it is slurred speech or dragging speech, or they're not finding a proper word to speak. So depending on this, the speech therapist can easily treat it and make sure that they are able to communicate their problems with the opposite person. So by these techniques, depending on the mild category or the severe category, speech can be achieved by the patient who had undergone stroke as such. So parents, we need to the family members or the doctors, we need to understand that it cannot be identified or treated later, or it cannot be taken as once the patient has undergone stroke, speech can never be achieved. No. Please identify it earlier and treat it earlier so that they are not losing any more further skills. And sometimes many think that let us address the physiotherapy part first, and in case it still doesn't come, then the speech therapy part. But we need to fix this in mind that the first 6 months is the golden period. In this 6 months, the neural system is still active to get back to their original skills. In case the pruning happens within 3 months or 4 months, then even if we try to address the speech issues, the progress could be very late, and sometimes we have to say that there's no much hope of speaking or communication skills to achieve back again. So we are not only treating the speech as speech therapist. By communicating, we are able, by creating a communication skill of the patient, we are able to address the other problems also. The moment the patient is able to communicate, he can talk more about what is happening in his body and what is his needs, and create motivation and encourage him to go par with his lifestyle back again. So in case the communication is missing, slowly their interest of doing anything, even swallowing, memory and movement, even if physiotherapist achieves the functional movements, they don't want to move because going anywhere doesn't make sense to them. They don't want to memorize or invite anyone to home as guests because they'll not be able to speak and communicate with them. So they will be restricted to one particular place or area, and they don't want to go back to their work only because they lost their speech or communication skills. So please, in aphasia or stroke patients with hemorrhage or whatever diagnosis we get depending on the area of the stroke, address the speech problem in case the patient is finding the fluency issues or communication issues first, along with the other treatment plans as such. Do not delay it thinking that one after the other, we'll finish one and then later, so that then we might miss the golden period, which is very important for them to achieve their speech skills.